medicine was different. You did rounds in the hospital, you saw patients, you could go to grand rounds once a week, you could do all kinds of things that were educational, supported by your institution. And when you went home at night, you could read journal articles. What's happened is there's been more and more pressure put on healthcare deliverers to see patients at a much faster rate.
It's not so much what the actual work is, it's what your belief system is that is in back of it, and how you carry it with you. This isn't just something that you do when you go to work at 8 o'clock and finish at 5. This is something that you live and breathe every single day. And I've seen that quality of compassion and kindness and charity and love and healing in all aspects of who you are since I've known you. And I think when you apply that, it makes for a healing environment within an individual.
Live from the Bay Area's news station, this is the KRON 4 Morning News.
Losing weight is all in your genes and not those denim things hanging up in your closet. We're talking about DNA. That's the premise of a new book. It's called the Apoe Gene Diet.
We now know more about genes, and we now have a lot more information about nutrition and exercise, because that's an integrative approach, and integrative medicine is coming into healthcare now. And I think that's now exciting, because a patient can take this information and use it to benefit their health in a very positive way. I think one of the most important things about diet today, it's very confusing for the public and also for the medical field. And this is a diet that really is based in science and offers a solution where before we really had a lot of confusion and not a lot of support to be successful in a diet. And that, I think, is what this book is about. It is an integrative medicine approach to being successful with the optimum health.
Well, I think integrative medicine offers a lot more than standard medicine. First of all, it really gives the physician a chance to know the patient as a person, to understand all aspects of their lifestyle, how they're put together, to see many opportunities for intervention, for change that the standard physician does not see, both because of constraints of time and because the focus is only on the physical body.
Integrative medicine really is just good medicine. It's good medicine. It's medicine that puts the individual or the patient at the middle, at the center. And around that individual then are all of these different approaches, modalities, practitioners, clinicians that are there to support them in their journey of health and well-being.
I mean, everything with the whole integrative medicine approach is really about balance. In my mind, it's about balance.
This whole process I had been through had really saved my life, because now I have a happy, prosperous life to look forward to, healthy and active and you know, all full of possibilities, instead of a life where I would have felt just depleted and defeated and isolated and deteriorating and all of the things that I was feeling before I began these changes. So I really feel like it saved my life.
Exactly what Pam's done with her practice and her gift of education and her gift of writing to others. One inspired nurse can do a lot, and I think that's how we're spreading the word successfully.
We are truly at our infancy here. We really are beginning. We're at the beginning of an era that is going to yield us some wonderful tools. And when you're looking at bringing this wonderful science, integrative medicine, nutritional medicine, and you're bringing all of this together, it is just, we have the tools and we can make it happen. We can make the change happen. We have everything we need. We just need to put it into play.